In this video, find out what can cause cardiovascular disease, heart disease and premature death, what vast studies support this information and proven methods to lower your risk. Most illness is due fundamentally to malnutrition. This not only includes the chronic diseases, but also viral and bacterial acute illnesses, which are greatly aggravated by inadequate nutrition. The usual U.S. diet provides an insufficient amount of vitamins to maintain optimal health, and the evidence base for the clinical effects of vitamins is increasing rapidly. Only 3% of a large sampling of U.S. adults practices what is commonly considered a healthy lifestyle. An American Medical Association survey of 153,000 men and women between the ages of 18 and 74 found that only 23% reported consuming 5 servings of fruits and vegetables per day. Recent federal nutritional guidelines specify a minimum of 9 servings of fruits and vegetables per day. Many Americans find that consuming the minimum quantities of fruits and vegetables each day is impractical and appear unable to provide the needed nutrition for themselves and their families. An alternative is to eat all the fruits and vegetables possible and supplement with a multivitamin multimineral, 400 IU of vitamin E and 1000 milligrams of vitamin C. An even better alternative is to supplement twice a day after meals. The usual U.S. diet provides an insufficient amount of vitamins, yet decades of scientific evidence has shown that vitamins, especially vitamin C and E, are of the utmost importance to human health. Two-time Nobel Prize winner Dr. Linus Pauling was among the first to realize vitamin C's crucial importance in the maintenance of a healthy immune system. In 1970 he proposed that regular intake of vitamin C in amounts far higher than the recommended daily allowance, or RDA, could help prevent and shorten the duration of the common cold. Although the medical establishment immediately voiced their strong opposition to this idea, many ordinary people believed Dr. Pauling and began taking large amounts of vitamin C. Most people immediately noticed a great decrease in the frequency and severity of their colds. A study conducted by the Centers for Disease Control and Prevention indicates that when multivitamins are combined with antioxidants such as vitamin E, death risk from heart disease, cardiovascular disease and stroke goes down. The study compared the death rates of persons who used multivitamins with E+ antioxidants, or antioxidant vitamins only, versus the death rate of those who used no vitamins at all. Persons who took vitamin E and antioxidants, along with multivitamins, had a 15% lower risk of dying from heart disease than those who took no supplements at all. A Californian study concluded that people who consume more than 750 milligrams per day of vitamin C reduce their risk of dying prematurely by 60%. Researchers from the National Institute on Aging report that elderly people who take vitamin C and E have a 50% lower risk of dying prematurely from disease than those who do not supplement. The New England Journal of Medicine has published 2 articles, both of which clearly support vitamin E supplementation. Persons taking E supplements had an approximately 40% reduction in cardiovascular disease. Nearly 40,000 men and 87,000 women took part in the study. The more vitamin E they took, and the longer they took it, the less cardiovascular disease they experienced. Such effective quantities of vitamin E positively cannot be obtained from diet alone. Points to remember. Two-time Nobel Prize winner Dr. Linus Pauling estimated that the rate of heart disease would be reduced by 80% if adults in the U.S. supplemented with 2,000 to 3,000 milligrams of vitamin C each day. 2 landmark studies published in the New England Journal of Medicine followed a total of 125,000 men and women healthcare professionals for a total period of 839,000 person study years. It was found that those who supplement with at least 100 IU of vitamin E daily reduced their risk of heart disease by 59 to 66%. The number one side effect of vitamins is failure to take enough of them. The reason one nutrient can cure so many different illnesses is because a deficiency of one nutrient can cause so many different illnesses. Restoring health must be done nutritionally. All cells in all persons are made exclusively from what we drink and eat. Not one cell is made out of drugs. Supplements are not the problem, they are the solution. Malnutrition is the problem. Linus Pauling defined orthomolecular medicine as the treatment of disease by the provision of the optimum molecular environment. especially the optimum concentrations of substances normally present in the human body. Orthomolecular medicine uses safe, effective nutritional therapy to fight illness. Subscribe and like below and check out our next video.